Today we're talking about MCAT Foundational Concept 9A, and the title of today's topic is Identifying Health Disparities. Now, before you can identify a health disparity, I guess you need to know what it is. So let's define what a health disparity is. Now, this is just my own definition, but a health disparity is a disproportionate difference in the health or health outcomes within a population. Now, to understand disparities in general, I like to think of the three basic needs of a human being, and those are food, shelter, and clothing. And because you need money to have any one of these three things, I'm also going to throw in money. Now let's talk about how a discrepancy in any one of these areas could affect health. And let's talk about food for our example. Now I'm going to use the city of Washington, D.C. to illustrate this because that's where I live. So Washington, D.C. is kind of a diamond-shaped city, and the city is divided into different regions based on geographical quadrant. So there are four quadrants to the district. There's northwest, northeast, southwest, and southeast. Now, in Northwest DC, you have things like the monuments, tourist attractions, museums. You have lots of businesses. That's kind of where the business district is. And you have medical schools and hospitals in this area as well. So what does this mean in terms of food? Well, if you have lots of tourists, if you have lots of business professionals that live and work in this area, you're also going to have lots of restaurants. You're going to have grocery stores. You're even going to have farmers markets. Now, how does this compare to Southeast DC? Well, Southeast DC is primarily a residential area. This means that you have row houses, you have single family homes, and you have multi-unit apartments. Now, you would think when it comes to that it would make sense that you'd have even more restaurants, grocery stores, and farmers markets in Southeast. But according to a 2009 article in the Washington Post, what they found was that in Northwest DC, there were 16 total grocery stores, and in Southeast, there were only 3. So when it comes to putting that in terms of population, that means that in Northwest DC, there's roughly 1 grocery store per 8,900 people. In Southeast, that means there's 1 grocery store per 47,000. Now you may be thinking to yourself, if there's only 1 grocery store per 47,000 people, where in the world are these people getting their food from? Well, they get it from fast food places, they get it from the corner store, from the bodega, and they get it from convenience stores like 7-Eleven. So how do the health outcomes of people that live in Southeast DC compare to those of people living in Northwest DC? Well, when it comes to chronic diseases, there's an increased rate of hypertension in Southeast, increased numbers of obesity, there's increased death due to cardiovascular events. There's increased diabetes, increased infant mortality, and increased HIV. Now, you can probably see a connection between these two just by thinking about what kind of things are in this food. Now, when I go to the corner store, the kinds of things that I'm looking for are snacks. I'm looking for chips, maybe tasty cakes or a donut. I'm looking for sodas, maybe a Coke or a Diet Coke. And fast food, regardless of what type you're eating, if we're talking hamburgers and French fries or fried chicken and biscuits, there's an increased amount of saturated fat compared to food that's cooked at home, not to mention an increased amount of sodium. So just looking at the contents of the food compared to the health problems that are in this area, it's really easy to see correlations. An increased amount of sodium in the diet is linked to an increased rate of hypertension, Increased saturated fat is linked to increased levels of obesity. When you have increased hypertension and increased obesity, you definitely have an increased rate of cardiovascular events. When it comes to infant mortality, we have questions of the nutrition of the mother, nutritional deficiencies in children, not just infants. And so, just looking at one of these factors between food, clothing, and shelter, it's easy to see how a deficiency or a deficit in just one of these areas can create a serious health disparity for people. Okay, so when it comes to looking for health disparities, how are we going to identify them within a population that we might be seeing? Well, in the example that I gave, what we were looking at was an area that was much lower in income. Now, unfortunately, this isn't a trend that is just applicable to Washington, D.C. Typically, lower income areas, really anywhere that you look at, have fewer resources available to them. They have fewer educational programs and really fewer agencies that can help them. Also, just because we were talking about an urban environment doesn't mean that this is the only place where health disparities exist. We need to think about rural populations that may simply not have health resources. They might not have enough doctors. They might not have enough hospitals there. And these people would also be considered to have health disparities simply because of their lack of health resources. Now, a population that we sometimes forget about is the elderly, but a lot of these people are on fixed incomes, which limits the medications that they can get, the treatment that they seek, and also think about the social support that's needed to maintain their medication regimen, to keep them up to date with their appointments and everything that's needed for daily health maintenance. The disabled or the disadvantaged. And this doesn't just refer to the physically disabled. There are a lot of mentally disabled people that are living in low income areas or that are living on the street that simply don't have access to the type of treatment that they need. And as a result, there's a significant health disparity that you can see between them and their counterparts in other areas of the city or other areas of where they live. And unfortunately, our last category is based on racial identification or minorities. There still is a huge correlation between minorities and health disparities. Now, in the United States, the two biggest minority groups are African Americans and Hispanics, but depending on the region where you live, this may be different. In Northern Virginia, which is just south of Washington, D.C., there's the largest population of Ethiopians in the country. So you need to think about minorities that are coming into your clinic or your hospital, wherever you're working, and think about the disparities that they may be experiencing simply because they are a minority and they're new to this country and they're not they don't have the access that other people would have. Okay, well, I don't want to leave you totally hopeless about health disparities. So, in the next module, we're going to talk about what to do when you identify these disparities, what the solutions are.